Hi, my name is Richard Train.
And I'm Hogan Allen, and we're the co-founders of Get Results Marketing and Business Coaching.
Now, last night on our Blog Talk radio show called The Whole Tooth, we really had one of our best discussions yet. Dr. David Ahearn.
Yep, one of Dentistry Today's top 100 speakers.
Right, fantastic guy too.
Absolutely.
We had probably the longest discussion.
53 minutes.
Something like that.
And it went by like that.
I know.
I was tired at the end.
So many points to discuss, but we still like to boil it down to our top 5 for you.
Yep, the title of his talk last night was The Capacity Bottleneck. How to avoid getting yourself into that situation with your practice. So we boiled it down to our top 5.
Yes.
Let's get rolling. Let's get right at it.
Let's get to the first one.
So, first one. Go ahead.
So, what becomes expensive as a dentist is really when you bottleneck yourself.
Yep. You as the dentist, you are the product.
Yes.
So if you constrain yourself, no one else in the office can make money, including yourself.
When you think about it, if you know that you need to expand a little bit, you can build the rooms. Building the rooms themselves are fairly cheap if it's done correctly. Agreed.
Next point. Another big reason that a lot of doctors restrain themselves is they don't have the vision to be able to see if I build it, they will come. That whole theory from that. And if you don't have that vision, you can't grow.
Exactly.
So you gotta take, sometimes you just gotta take a chance as well.
And maybe you need to consult with somebody who can help you with that vision.
Absolutely.
Third point, sometimes the doctor can be the problem behind the capacity restraint himself.
Really?
Or herself.
Really?
Well, it's possible. Well, look,
it can be possible.
That's what Dr. David Ahearn was saying,
and
we agree with him because we see it a lot too.
Yep.
For instance, so what happens if you're only working? The practice is only open during the time that your staff wants it to be open, and you don't work during certain times that might be peak hours.
Absolutely. Before normal business hours, after normal business hours, making sure you're open during lunch sometimes to accommodate people if you're in the situation where you're in a high traffic area.
Yes.
Those kind of things.
Yes.
Fourth point, bear with me, it's a good one, but it's a long one. So, the true risk in expanding is that you could have rooms that are under capacity. It's really everybody's biggest concern. I build them, they're sitting here, and I'm not filling them.
Right.
That's really been the biggest thing.
Don't fall into the trap of thinking that if there's nobody in it, that you're not actually making money.
Absolutely. One of the best ways to avoid this, I think, is making sure you have very good front desk training to be able to handle all your new patient calls.
It's all about systems.
Yep. And recall system to make sure you're getting back in touch with your current patients.
Exactly.
If you do that, you don't have to worry about filling your whole office with all these new patients.
Well, and think about it this way. If you are 2 months, 3 months, 4 months out, a lot of people brag about that, but that's not necessarily the way you want to go. You're not providing the customer service that you want. So if you provide the extra capacity, what happens is people start coming to you because they get that immediate gratification.
Now, all the reps out there, close your ears for a second, because this is another good thing that he brought up, and he's right. You can go ahead and build the room, but you don't have to fill it with equipment right away. You don't. You can wait until they're knocking down the door to get in.
Just get yourself ready.
Exactly. So, fifth and last point.
Every dental practice is different.
Yep.
Believe it or not. Every dentist is different. So
they're all their own small business.
Your capacity restraint really will look different for each practice depending on whether you want to do cosmetic procedures or whether you're doing sedation or whether you're doing veneers or what have you.
Yep, absolutely. So, to close, make sure you come back next week, listen to us, download us, however you want to find us, any which way. Great topic.
It's going to be a fantastic one.
September 21st, 8 p.m. Eastern Time, just like always.
One of our friends.
Consultant superhero, in my opinion, Miss Rhonda Mullins.
Yes.
She is as good as it gets. And
Transition
she is
specialist.
a spark plug.
Yes.
So she's going to be a good one. So make sure, her topic's actually called Vital Pitfalls to Avoid for Transition Success in Dentistry.
Is that for you to say?
Exactly. So, for any questions or comments about the show, Richard, we have a new thing on our website.
Fantastic. It's called Our Shop.
Yep, absolutely. And it's at getresultsfordentists.com. And we already have, from the first 2 shows, we have transcripts. So if you're a reader and you'd rather sit and read it, feel free. You can go there. Nominal fee. You can download them. They're yours.
Absolutely. Very easy to do.
Absolutely.
We're adding more as we speak.
Absolutely. So if you have any questions, give us a call at 800-275-2350.
Or visit us online at getresultsfordentists, all spelled out, .com.
Yep. Have a great week.
Thank you.